Hello and welcome. Bonjour, salam alaikum. This is a 20-minute exercise video for anybody with knee pain or hip pain. We are going to work on the core muscles in the pelvis, the abdomen, the lower back. We're also going to work on the thigh muscles and the outer hip muscles. So it's going to take 20 minutes. Get yourself a glass of water, make some time to do this, and we're going to begin with a warm-up. So one of the nicest warm-ups I like is just getting the hips and the knees going side to side. And I'll just show this to you from here. So keeping the tummy muscle in, tailbone in, shoulders back, spreading the stance a little bit and just lifting up to one side and the other. And you can see that I'm really using this core strength to lift the knees up. If your balance is bad, just take a chair. Okay, and keep going. If you want just a slightly more strenuous workout, or warm-up, you can just do some on-the-spot running. So just relaxing the head, getting the shoulders back, tummy in, tailbone in again, and we're just raising the knees up. So I'm going to keep going like this while I talk for the warm-up. Whichever suits you, keep going. The exercises are going to be in repetition, so 20 to 30. If this is the first time you've done exercises like this, please just do 5. Take a rest. If you can keep going, try another 5. If not, just build it up week to week, adding 5 each week. These exercises are considered resistance training, so they are recommended twice a week for everybody. They improve the density and the quality of your bone by the muscles that attach to your bone, causing increased uptake of nutrients. So you need to be eating a good diet at the same time. So they improve bone density, and they also reduce your blood pressure, so your risk of heart disease goes down. Lots of reasons to do them, just twice a week if you can. It does take 20 minutes to really do this workout properly, so almost finished, getting the knees nice and high. And when you're ready, just come into a rest. So I'm going to move back against the wall here for the first exercise, which is the wall squat. So just coming down the wall, holding the tummy in, tucking the tailbone in again, so that your back is really almost flat on the wall, getting the shoulders back and down and opening up the chest. And tucking the chin just a little bit. You hear about this position quite a lot. Tucking the chin means as if you have an apple under your chin, just holding an apple there, and that elongates the spine. And I want you to just relax and breathe. If you've never done a wall squat before, just probably the most important thing is to remember to keep the knees directly above the ankle. So you can see here that my knees are not swaying forward, so you don't want to do that. Puts too much strain on the knees, unfortunately. So you just want to keep the knees directly above the ankle. The lower you come down into the squat, making a right angle, the harder it's going to be. So I usually just stay up here. You don't want to be right up, otherwise you're not going to get a good workout. You're not going to create change in the muscle. So keeping the arms up. And I use this exercise as a form of meditation. So I do my best to forget everything I have to do later on today. Completely let it go. Now that doesn't mean you're not going to have little thoughts popping into your head, getting in the way, but that's normal. Just let them go gently. And I like to concentrate on the breath. So taking a nice big breath down into your abdomen, pulling down the diaphragm, opening up the chest, breathing into the back of the lungs, and just really relaxing. I'm focusing on nothing but the breath. If you have some music on, you can also focus on the music, listening to the rhythm of the music. And as those thoughts from your day ahead, or maybe your day yesterday, come into your head, just gently let them go. each time coming back to your breath, to the sound of your breath, or to the sound of the music, whichever you feel most comfortable with. And if this is the first time you've done a meditation like this, don't worry. There's nothing strange about it. It's a very useful way to relax the body. And quite often you don't get that chance during the day. Or you just forget to make time for it. So you can see I've got my arms up here, so I like to do that. It just gives a little bit of a workout to the arms. You can also just set the arms gently here and relax. So this workout's going to take about a minute for the wall squat. And when you're ready, if at any point you're too tired or too sore, just come forward, just push back off the wall like so, okay? The next exercise we're going to do is called bridging. So we're going to just lie down onto the floor. So these are all core exercises. That was primarily for the knees, the last exercise. So you should be able to see me well here. I'm just going to lie right back. I've got a nice Moroccan rug to lie on. If you've never done the bridge before, just follow exactly what I'm doing. So you can see I can just touch the back of my heels with my arms. My head is completely flat, there's no pillows, there's nothing under me. Make sure it's a good firm surface on the floor, maybe with an exercise mat or a rug, it doesn't really matter, or lie on carpet if that's what you've got. And the first thing I do is I tilt the pelvis back and start raising up or lifting up from the pelvis. And you can see I can still touch the backs of my heels. Lots of you will have done this exercise, but some people won't. And it's great, this is great for the core. And you just lift it up as far as you can go. Some physios say clench your bottom muscles, clench your thighs, clench your tummy muscles. Whereas in the yoga practice, they would teach you to just relax, just lift up from the pelvis and breathe. And again, using this as your meditation while you're strengthening your muscles, okay? So you can really see my tummy moving as I breathe in and the chest coming down as I breathe out. And if you're not really sure what you're doing, just push down through your feet and lift up further from the pelvis. And we're going to hold that for approximately a minute. Now, some people can hold this for 5 minutes. And you can modify this workout as you go. You can do it a couple of times over if you've got 20 minutes. If there's an exercise you don't like, come back to an exercise you do like. So you might want to do the wall squat again during this circuit or during this routine. And the reason we want to build strength is we know walking and running and cycling are good for your heart. You're going to live longer, you're going to be healthier. But we also know that strengthening exercises improve your bone density, so how dense your bones are. Therefore, you're not going to get osteoporosis as easily. The strength training, so this is called strength training or resistance training, can also reduce your blood pressure and again also reduce the risk of heart disease. So it's not just those walking and running exercises, but it's these strengthening exercises that are really important. And you should be doing this. If you can do this workout every day, that's brilliant. If not, twice a week, on top of doing something like walking or running most days of the week. And so I'm sure we're going for more than a minute. Now, you can come down slowly, or if you're not too tired, just stay in that position. Okay. And we'll just bring the knees up to the back, like so. Or sorry, up to your chest, like so. Okay. And from here, just going to come straight back up again. So check in your position. So shoulders should be almost flat on the floor, touching the back of your heels, lifting up from the pelvis, and this time all we're going to do is push down through the left leg with your foot so you get balance. Lift your right leg up
and we're going to do 10 of these. Make sure the pelvis is just horizontal. If it's too hard, don't worry, go back to your bridge, okay? This could be something you work towards after around about 4 weeks. So I haven't really done much of a workout in probably the last, I think, week. So that should be around about 10, hopefully, not counting. And just holding the pelvis up. If you want, again, come down. Bring the knees up to the chest just to loosen out the lower spine, even rolling from side to side. Okay. Facing the feet down and doing the same exercise on the left side. So pushing down through your right foot, which helps lift the pelvis up. Lifting the left foot up. And we're just doing leg raises again. If you're not sure what you're doing, or you think the explanations in this video are just not clear enough, I advise going to see a physio and getting some help in your positioning, making sure you're doing the exercises correctly. And you can also get somebody else to look at you and check that your position is good, somebody that knows how to do the exercises. So it might be even somebody in your gym, a sports trainer or a physical trainer. So we're almost done here, just one more. And these are brilliant exercises. So we're just going to come down gently, like so. Bringing the knees up. You can roll from side to side. And when you're ready, we're going to do a sit-up. So this is the way I like to do a sit-up. Everybody does it different. I like to bring the feet up, like so. You can keep your feet down. Now, the only thing I really do here is lift the shoulders up. And obviously I'm lifting the head a little bit as well with the shoulders. So you breathe in when you're lying down. Alright, just breathe in. And as you come up, you breathe out. And we're going to try and do 25 of these, so we'll keep going. Keeping your focus on the ceiling or whatever's above you, might be the sky. Oops, just fixing my position. Okay, that should be about 25. If you're tired at any point during these 25 exercises, whatever we're doing, just take a wee break and start again. So I like to just loosen the hips up a little bit in this position too. A lot of Pilates instructors will tell you, and physios as well, that you're helping lubricate the joint a little bit, so no harm in that. And easy does it. Don't push yourself. If you're sore, if you've got a sore foot or something that really hurts when you're doing the exercise, don't do it. Just pick another exercise or wait till the next exercise that's coming up, or do the exercise before, whichever suits. Okay, so let me think what else. So that's pretty much us in terms of those major core exercises. The next one I like to do are for the hips, so the external muscles of the hip. And in women, these tend to be very weak for some reason. I think it's because their hips are wide here and then come in. And so you can see here, they're wide. And it's called the Q angle. So the muscles along the side here sometimes are weak, get overstretched, and usually need some attention, and you don't tend to get that when you're just walking in a straight line. So the first exercise I'm going to do, you should have a pillow just here. I'm just going to use my arm. So making sure the shoulder, the bottom and the feet are all in line. And this is called the clam, or I call it the clam. And I've been doing this one for a wee while. I don't do it every day, I probably should. So just lifting the thigh up like that. Another modification is bottom leg straight and just letting the foot of the top leg, so the foot of your left leg is sitting on your right knee, and you're just lifting the left leg up. And I can really feel this every time I do it, and sometimes I don't feel like I'm getting much stronger, but even just activating these muscles is really beneficial. And we should be aiming for about 30 of these, 30 or 40. Whatever you can do. If you're tired, you just stop, just relax, okay, and start again. So we'll try about another 15 of these. So I don't count. I mean, I do count actually, I do count. The problem is I'm talking at the same time here. So I usually do them until I'm tired, but I am usually counting as well, so I get an idea day to day how I'm doing. So that's me, I'm pretty much done on that side. Whew, that was good. So, just coming over onto the other side. And same again. So I'm going to keep the bottom leg straight. Just bringing the right leg bent up at about 45 degrees, so the knee's out. My right foot sitting on my left knee, and off I go, just lifting up this side. You might need to use your hand like I'm doing, just to balance yourself. And we'll keep going. So I'm going to count these now. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Just going to stop. Forgot to say, make sure the hips are stacked, and that means that they're vertical, so that you're not leaning back or that you're not leaning away forward. So it should be vertical, this hip here and this hip directly above it. So we'll keep going. 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and that's me done. Okay, and you can just lie onto your back and relax for a second. Okay, so the next exercise is again for the thighs. We've worked the core already in the bridge position, and this is just a simple leg raise, so just lifting the leg up. And this is probably one of the easiest exercises. And when you lift it up, you can just turn it to the side like that. And you can see how I've pointed the toes out to the left. And this is useful just to work the inner part of the thigh, like so. And you want a little bit of a space under your back for this, okay, so not flat on the ground, but just a little bit of space. Keeping the core strong. You don't need to do it too fast. Just go nice and slowly. Okay. Again, breathing. The breath doesn't matter so much in terms of breathing in or breathing out. Where your foot, in relation to where your foot is, but just breathing gently. And we're going to do about another 15 of these. You should be able to feel the core working. And this is a really good test of core strength. So I'm beginning to tire just now. And just at the top, you can do a few little short ones. And then just coming back down again. Okay, very good, that's great. And the last one again is just on the right side. So again, turning the foot out. So pointing out, but just keeping it vertical. Making sure there's a space under your tummy. And we're just gonna go again, nice and slowly. You can see I started off a little bit fast. Sometimes immediately the mind thinks I've got to do this quickly. when in reality the slower you go, the harder the exercise can be, okay, and the better controlled it will be. So your position will be better, you'll remember to have a bit of a space, you'll try and keep your pelvis stable when you're doing it. So the pelvis should be as stable as possible, not rolling forward or backwards. And not coming the whole way down, just going from top to about 20 degrees. So from about 60 degrees to 20. And we're just going to do 10 more of these. So, doing really well, remembering to breathe, keeping the pelvis stable. Okay, and just at the top again, just do a few little small ones. So this is when the thighs are going to burn, and if they're already burning, just come down. Okay, that's me done. Whew. That's good, and if you just roll over onto your side, push yourself up gently. And I'll just do that actually, like so. And just again, we're going to take 10 breaths here. If you've got time, I recommend you finish the workout like this. And again, focusing on the breath. Getting the shoulders back and down, tucking the tummy in, opening the chest up here, tucking the chin, and just relaxing. And any thoughts that are coming into your head of what you might have to do next today, just let them go. Just let them float away gently. So thank you everyone. I hope you have a lovely day and keep active.